When I first found out that these changes were happening, I called my GP, I got an appointment, and I said, I'm going to need you to take over all of my medications from here on out. Are you able to do that for me? Because I'm not going to have access to these medications anymore. And she was like, I am not equipped to do that. Like, she just flat out said, I don't understand your conditions in the way that Dr. Rick and Dr. Jane do. I don't understand all of these medications and how they interact with your conditions. And she said to me, I'm going to do whatever I can to help you in this situation, but I need to be fully transparent that I am not equipped for this. So she ended up setting me up with a clinical pharmacist. We then had 5 one-on-one appointments, and we have another one upcoming to go through my full medication list, top to bottom, to break it down, to make sure that what I was on was appropriate, that nothing was misdosed or whatever, so that my GP could feel even remotely comfortable beginning this process with me. She was not impressed. And she's lovely and she's willing to work with me in whatever way she can, but GPs are not equipped for this. This is not their role.
I think, correct me if I'm wrong, Rick, but the College of Family Doctors of British Columbia actually do support us.
And the Specialist Society.
And the Specialist Society as well. So they do have a vested interest in us continuing, and they want us to continue to help. We are hoping that will speak to help going forward, but that hasn't transmitted to help in the ministry of hearing that message. But you're right. I think a primary care practitioner without support from someone like Dr. Arsenault or myself is going to struggle, and that is unfortunate and not necessary.
That's also why we have what's called our primary care toolkit. The 2 clicks on our website, resources, primary care toolkits. We have diagnostic criteria, we have medication handouts because we use medications differently. So all of those things, and in each of our consults, we put a link to our primary care toolkit. So to help family physicians who are interested to learn more about this, because some are. So for instance, Dr. Zeidler is a family physician who takes care of a lot of trans patients. And what's interesting, she has noticed the same thing as us, which is that trans patients are more likely to develop these conditions. It's not in the literature, it's just something that we've noticed. And we both think that it has to do with the role of adverse childhood experiences. And so we have the whole spectrum. We have Dr. Zeidler, who came and did core group. And so she spent 16 weeks learning about this and listening to the patients. And then at the other hand, we have patients who've actually been fired and explicitly told, if you want to work with Dr. McKay or Dr. Arsenault, I will not be your family doctor. These are not real conditions.
This is a major issue. I feel incredibly lucky and privileged to have landed the GP that I currently have, because I know how bad it can get. And I talk to patients all the time who either don't have a GP at all, have been fired by their GPs because of situations like this, or just simply don't feel safe to go see their GP. I think that this situation is going to flood the medical system in the ERs, in the GP offices, in all of the specialists, because I used to see my GP multiple times a month to attempt to manage these conditions. And now I see her like a few times as needed because my conditions are managed through the support of your clinic.